There is news from our nation's capital that could impact you and your family's health with a strong Columbus connection. Last night, HHS Secretary Robert F. Kennedy Jr. fired what is called the ACIP. These are medical experts from across the country, business experts who have a special focus on medicine, immunizations, and he says there are a number of conflicts of interest on the board. Among those on the list, our own Columbus Public Health Commissioner, Dr. Mysheika Roberts, who received a letter this morning, an email in fact, and she is joining us to talk about that. And Dr. Roberts, we appreciate you being here. A short to the point email.
Yeah, very
Tell
short.
us about that.
Yeah, email came into the mailbox around 7:25 last night, just saying that your services on the Advisory Council of Immunization Practices, or Advisory Committee on Immunization Practices, is no longer needed, and you're being terminated effective immediately.
And so, first tell me your immediate reaction to that.
Well, I wasn't surprised. I mean, I've been reading the news stories about it, and this was a committee that I was appointed on at the end of 2024. My term was scheduled to start July of this year. And so with the new administration coming in, I was always a little pessimistic about what would really happen. And so I can't say I'm really surprised, but I'm definitely disappointed, and I'm concerned about the guidance that we'll get from a public health perspective on immunizations moving forward with this administration.
And before we talk about that, because of course that's critical, I want to unpack some of the comments that we heard from the secretary that some of the people on this committee had conflict of interest. As somebody who was named to that committee, what is your reaction to that? Do you have a conflict of interest?
No, I do not. And I think I had to fill out multiple forms to say what conflicts I would have. And so if they did have conflicts, they had to disclose them. And we all have conflicts, right? We have relationships, we have investments. And so I feel that the committee was a diverse group of healthcare professionals who would be able to put their conflicts aside to make the best decisions for the United States public.
And so let's talk about the impact, because there are public health experts like yourself on this who can talk about the importance of vaccines. And this comes at a time when we're seeing pertussis on the rise in Kentucky. We just got through the measles outbreak here in our state. What is the impact? Our kids in the summer, we're trying to get them in to get their vaccinations for the next school year.
So the ACIP is a body of individuals, professionals, as you mentioned, who get guidance from the CDC. They get all of the information from the vaccine manufacturers, and they review it. So it's an independent body that is able to do a second look at this data and decide, one, is the vaccine really effective? Does it help a disease that we're trying to manage? Two, does the vaccine, is it safe? And so we're looking over the safety data as well. And then based on the recommendations, the voting of that committee, they decide what is the vaccine recommendation. And I really want to emphasize, it's a recommendation. Whatever the ACIP recommends, just like CDC, is not a mandate. Individuals always have the decision to get those vaccines for themselves and their family members. But based on the ACIP recommendations, that's what our insurance companies decide that they're going to cover. So if the ACIP does not authorize it, insurance companies don't have to cover the cost of that. So
this could turn a few things on their head, so to speak, because we look to our insurance to cover those child visits and that kind of thing.
Absolutely. So if the ACIP is not reconvened, and if they don't make decisions, or if they decide not to recommend a vaccine, that could mean vaccines that we've been getting for a long time and have been keeping us healthy and safe could no longer be covered on your insurance, and you'd have to pay out of pocket for the vaccine. And I just want to remind people, we've seen these outbreaks of measles, we've seen pertussis, but if you go back 100 years, those were the diseases that were killing our communities. And with the advent of antibiotics and vaccines, we've seen a reduction in infectious disease deaths as well as infectious disease hospitalizations.
Which is frightening when you think about babies who are trying to catch their breath from whooping cough. What is going to be your best advice for families who will be watching so that they can keep parents, guardians, to keep their children safe?
I would say, we know what the vaccine schedule is, and if you want to protect your loved ones from these infectious diseases, follow that vaccine schedule. The American Academy of Pediatrics is still going to follow it, so go to your provider and ask for the recommended vaccines. I'm concerned about new vaccines that could come out and what type of review they will go through. FDA will still have their process, so that is reassuring. But who will recommend the vaccines and for which age groups and what timing and duration, that's what I think we all need to be mindful of and aware of. But the vaccines that have been approved, the vaccines that are on the recommendation list, you should still continue to follow that schedule.
How could this impact COVID? Because that's been in the news too.
Well, obviously, there was a recommendation by the HHS secretary about who should not get the COVID-19 vaccine. That is not based on science. We want to follow the science. We know that COVID-19 infections during pregnancy can be very, very hazardous to the woman's health and the unborn child. So again, talk to your provider, talk to your pediatrician, talk to your OBGYN. Make sure you get guidance from them on how to proceed.
And I want to share with our viewers, Dr. Roberts was an Epidemic Intelligence Service Officer at the CDC. Give us just high level what that means you did.
Sure. So prior to coming to work at Columbus Public Health, I worked for the CDC for 2 years, and it was really a hands-on experience in public health and learning epidemiology. And so I was stationed here in Ohio, and I traveled all around Ohio to help different communities respond to outbreaks that they had in their community.
And in your experience in public health, it always has seemed that this has been, the ACIP, for example, has been sort of bipartisan, no dog in the fight. It's about the science.
That and the CDC has been bipartisan. And so as a public health leader in this community, it is concerning to see the changes that are happening at the CDC, ACIP, and HHS and everywhere. I mean, we have been doing these programs for years. We've been doing this work to fight infectious diseases, HIV, and a number of different public health issues. And yeah, we have more work to do, but now's not the time to withdraw resources from that work. If anything, we should be putting more resources into that work.
All right. Well, thank you so much for coming in and talking with us about this.
Thank you.